Good afternoon, everyone, and welcome to our webinar today, Nutrition Facts and Fallacies for Someone Living with MS. So as you probably noticed, I don't have my webcam on. I apologise. I started GoToWebinar today and it didn't want to work. For anyone that had worked in an office before, they know that tech problems do arise, and I do apologise for that, and I'm not really sure why, but you can just see Yasmine's face, and yeah, you'll just hear my voice today, unfortunately. Well, maybe fortunately. So your presenter today is Yasmine Probst. She's an associate professor, among a lot of other things, which I'll get to. And my name is Peter Butler, and I'll be your facilitator today. So just some housekeeping first off. So you should have the control panel on the right-hand side of your screen, unless you're using a Mac product, and it could be at the bottom side or top of your screen. So it should be there somewhere. You'll see on the control panel there is an orange arrow. So you can click that, which will minimize and maximize the control panel at any point, just so you've got more of the screen to look at. Also, the questions pane is probably the one pane that you'll possibly need to use throughout today's webinar. So if you do have any questions, please do throw them in there as we go, and I'll pass those on to Yasmine, who will get to those when she can. But also, if you have any things to just say or chat, still throw those in the questions pane, please. Also, Yasmine will ask a few polls throughout, which have written answers that she'll want you to respond to. So again, if you can chuck those in the questions pane, that would be perfect. So you should have got a copy of the handouts, yesterday afternoon. If you didn't and you would like them, please email us at education@ms.org.au. So we always do an acknowledgement of country before our webinars. So MS Plus would like to acknowledge the traditional custodians of the land throughout Australia, and we acknowledge the elders past, present and emerging, and we acknowledge any Aboriginal or Torres Strait Islander peoples with us today. So just an introduction on our presenter today, Yasmine Probst. She's an associate professor with the School of Medical, Indigenous and Health Sciences at the University of Wollongong, and a research fellow at the Illawarra Health and Medical Research Institute. She holds dual master's degrees in dietetics and health informatics, and is recognised as an advanced accredited practicing dietitian with Dietitians Australia and a fellow of the Australasian Institute for Digital Health. Yasmine holds a current senior research fellowship with MS Australia, and as a person living with MS, her research and teaching focuses on nutrition for people living with MS. That was a bit of a tongue twister. It obviously does a lot of things, and that's very impressive. So I'll now pass you over to Yasmine, who will share her screen, hopefully, if all works well. Great. Thank you, Yasmine.
Okay, thank you, Peter. And I'm coming to you all from Gundungurra country today. And I'd like to also acknowledge the traditional custodians of land from which I'm presenting. So, nutrition. It's a very hot topic in MS at most times. But today I'll talk to you guys about some of the facts and fallacies that we come across as people living with MS, and some of the interesting things that we hear about, I guess, on our MS journeys. I'll give you a little bit of insight into my personal journey as a starting point, but then I'll also make sure that I keep you all awake by asking a few polls throughout the session to get to know you firstly, but then also to see what your thoughts are in relation to some of the facts and fallacies that we'll be talking to today. So straight up with a poll, and Peter will be running this, but we're looking to see who's done a bit of research into food and MS generally. We'll just leave this open for a while. I can see the poll has been opened. Hopefully it's working on your end so you're able to respond to the poll.
I see, yes, about 70% of people have voted. So
Beautiful.
we're predominantly getting, I've read books and websites about it generally, and that's, around the 80% mark.
Beautiful, beautiful. That's actually what I was expecting to hear. You'll see in some of my slides later on. It's quite a common place to go to, but I won't say too much else at the moment. I'll keep moving through my slides with you guys. But thank you for responding. So this is probably one of the most common questions as a dietitian that I'm asked, particularly when I'm at the supermarket. So often out there doing the grocery shop, usually in a fluster with my kids, annoying me about what they want to put in the trolley or what they need to have. And I get asked, what should I really be eating? Not just for people with MS, but generally, what should I be eating? What should I put in my trolley? Is this good for me? Is this not good for me? Lots and lots of questions in the space. But I think it gets even more complex once you have a chronic condition. And once you have that influx of so much information that we've all been exposed to coming at you. So I'll touch on this question a lot throughout the session today, but it also will be a case of, we'll touch on some of the things that you hear about that you may think, I'm not quite too sure about that one, which is why we're looking at facts and fallacies. So here's a little bit about myself. So I'll take you on a bit of a quick journey. I won't bore you too much with my journey, but I think it's really important that you understand a little bit about what I've been faced with that has helped to really frame, I guess, my perspective on MS in particular, but also in terms of what has really helped to frame my journey so far. So yes, I moved from high school straight through into university life. I did my undergraduate degree in nutrition and then a graduate degree in dietetics, became an accredited practicing dietitian, which was my plan. And life was seemingly all well and good. I was your typical early 20s young person out having fun with friends and enjoying life. I moved on after that to do my PhD. I actually overlapped my PhD with my master's, so lots of stress going on at the same time. And that's when things started to change a little bit for me. So what actually happened there for me was I was starting to feel, I guess, the burning of candles, the candle at both ends, trying to do a lot of, I guess, work in the research space, which was what I was doing at university, but then also trying to keep my personal life very much on track. And the symptoms for me started with tingling in my feet. So I had numbness in my feet. It progressed slowly up my leg. I had some foot drop happening, and I thought, oh, this doesn't quite feel normal. I eventually, after ignoring it for a little bit too long, decided to go to the GP, who then referred me immediately to the ED, to a neurologist in the local area. And I was actually really quite lucky because my diagnosis journey was quite rapid and quite quick. But I know that's not the case for everyone. So the combination of the symptoms, I'd previously, a couple of years back, had unexplained flashes of light that I was seeing in my vision. We had the MRI, they found some lesions, and essentially, based on the McDonald criteria, I was diagnosed with having MS. I know that journey isn't as straightforward for others, and I acknowledge that that can be a very, very long and painful journey for some people, and might be a trigger, and I apologise if that has brought up any not so appealing memories. But I feel that setting the scene of that beginning point of your journey is really quite important, because it really is the game changer for a lot of people. It's the point when a lot of people do make big changes in their lives, and that was probably partly so for me, although I was in a bit of a stage of denial. So I'm coming up to my 18-year anniversary of the diagnosis this year. So back in 2004 was when I was diagnosed. I finished my PhD a couple of years later, ignoring the fact that I had MS, trying to just sweep it under the rug, so to speak. I did start listening to my neurologist. I did start medication, but thought, no, I've got control of this. I can do this. Life is, I can get on with my life and do everything like I did before. So tried to still, attend social events despite symptoms really interfering for me at the time. then I decided, okay, now it's time. I'm going to have my babies. I had my first, my second, and my third very close to each other, which wasn't necessarily planned that way, but I wouldn't change it for the world. But after my second, I definitely had a strong relapse. So the pregnancies were beautiful, but after him, it was definitely a case of something wasn't sitting right. So I had a strong flare up of my MS and had to make sure that I was on steroid infusions as a result of that. My dietitian hat on, I was really adamant not to stop breastfeeding, even though I was being told at the time, no, you must stop breastfeeding. You can't continue breastfeeding. You must, it's not good for your MS. So my researcher hat on again instead of my dietitian hat, and I researched everything I possibly could. Decided to wean him onto formula for a while, and then onto the steroids. Checked to see what the half-life of the steroids was, so how long it would be in my body for, and then eventually weaned him back onto breastfeeding. And I guess the journey went on from there because everything went well. And then number 3 came along shortly after. But then things got a little bit hazy. I went into that. I've got 3 toddlers essentially running around the house, stress levels everywhere. Not really too sure what happened in that stage between probably 2012 and roughly 2017, other than I was just trying to get on with life and hadn't gone back to my neurologist, which was probably the worst thing, in my opinion, now looking back. So lots of flare-ups, lots of symptoms, lots of stress, but the priority obviously was my kids who were at home with me. I was also at that point not letting work know what was happening. So work didn't know very much about my MS journey. They didn't know very much about what I was going through until I had a bit of a light bulb moment and realized probably in the later stages, so towards 2017, hang on, sharing this information is actually really quite important. I need a support network around me. And with that support network, I can actually make changes for the better. So at that blurry stage, I'd been trying to muddle my way through without medication, thinking that I could just control this disease without any help from anyone else. But that light bulb moment made a big difference. I was moved on to different medications immediately because things had obviously shifted since I originally was diagnosed. The medications made me feel absolutely fabulous. The fog lifted. I was almost symptom free within a very short period of time. And life was going on really nicely up until COVID hit. When I also had a few deaths in the family at the same time. So again, stress levels went up. And of course, as we know, stress and MS don't mix particularly well. So I was faced with another relapse. And this was probably the scariest one that I've had because having young kids at home, I know I want to be out there running around with them. And this one actually was affecting my ability to run around with them. So I had what I would refer to as jelly legs. And I was unable to essentially run. So I had to tell my brain to move my legs actively. And it was one of the scariest feelings I've had, to be honest. I've had a few various symptoms across the years, but that thought of I can't chase my child and play soccer with them was the biggest shock to my system. So back to the neurologist as much as possible during this later stage. And we've moved on to a nice high efficacy medication. And I've been feeling fabulous ever since. I haven't mentioned a word in there about food, and that was intentional because the whole way along, food has been, I guess, a component of my life anyway. So being a dietitian, I can't not think about food. It's a very, very big habit of mine. But at the same time, it's also something that I know that people don't necessarily prioritize in their lives or have very different thoughts about in terms of how food should fit into their own life. So for me personally, it's always at the forefront. And I tend to eat relatively well, which I think helped along the way a lot, but didn't completely detract from having progression in my disease state. So I guess that light bulb moment of clarity came along with a moment of, okay, what can I do? What can I help others with? And being a dietitian who understands about food, knowing that some people don't necessarily understand food particularly well, I just started to share my journey with other people. And that's really been the impetus to a lot of my research now. So helping others who also have a chronic condition, in particular MS, in terms of how to manage their condition and how they can try to do things differently for the positive, or things that could be swapped to be improving their lifestyle, or it could be any number of things. But that's been a very strong focus for me, and it's a really strong driver to keep my research going. It's, I guess, one of the reasons why I wake up in the morning as well. So that was a quick overview, or not so quick, of my journey so far in the MS space. You can see I've been doing a few things with the media. I've been doing a few things with my university. I've been doing a few things with MS Australia and MS Limited, and really trying to get the word out there about the importance of lifestyle management for MS. But we'll talk a little bit more about that in just a moment, because now, to see whether you're all awake, I'm going to bring up another poll. But this one, what we're going to do is, firstly, I'm going to move my webcam out of the way, is we're going to have a look and see how far are you into your journey. So I've got a few pre-prompted responses there for you. I'm a little bit cheeky in terms of the way I've written them, but I'm looking to see, are you relatively new to your MS journey, or have you been doing this for a while and you've been an old hand like I am? And, you know, I could probably have you on the webcam instead. So let's see how you go. You can see the poll is definitely open. Thank you, Peter.
No worries. We've got about half have voted, and they're coming in quick and fast. We've got fairly mixed response here.
Okay.
So we're sort of looking at about 35% for I'm muddling my way through diagnosis a few years ago, and MS doesn't control my life. I've got this. About a quarter of the people I know MS inside and out, back to front. I could run this gig, and 6% I'm brand new, helped me just diagnose in the last year. So awesome. That's most people voted now.
Beautiful. Well, thank you again for voting. Like I said, I'll try and keep you awake throughout this webinar. But no, it's quite useful because it gives me some insight into where you're up to. And everyone's MS journeys are different. Everyone's MS symptoms are quite unique. It's, you know, you've probably heard it referred to as a snowflake disease, because it is so unique in its nature. I'll just activate my screen again. So coming back to the question that I posed before, or the question that I'm often posed from other people. So I've got MS, and what should I be eating? And now we'll really jump into some of the nitty gritty there. Working out what is the science out there saying for us at the moment, and what are those really strong drivers in this particular area. So, but where do we start? You know, if we start a journey, we pack the car really full, and then we hop on and we drive away. Well, one thing we do know is that the management of MS is really shifting quite a lot. We know now that there's a pressure on the healthcare workers in the space to really be careful about the time between diagnosis and start of treatment. We know that people are becoming more aware and more open to various different forms of management, and self-management is really becoming a priority for a lot of people. And by self-management, I don't mean completely taking control of MS yourself. It means working on some parts of managing it yourself in combination with other healthcare professionals or your healthcare team. I think one of the reasons why self-management is becoming increasingly popular now is because of the idea that lifestyle can make so many different changes to the ways that we are responding to various medications, but also in terms of how we're responding to the disease overall. So there's a lot of research happening in terms of, you know, can lifestyle affect risk of MS? But for those of us who've been diagnosed with MS, we want to know, can lifestyle make a change for us while we've been diagnosed, and can we slow the progression of the disease? And what do we need to do to slow that progression? One of the things we also know is that being diagnosed with a chronic condition is almost like going through a grievance cycle. So when you lose a loved one, it's a similar process to when you're being diagnosed with a chronic condition. You go through those various stages of denial, of anger, and then eventually of acceptance. And depending on where you're at will depend on how you're responding to what's out there and around you. So I think during that phase that I showed you where I was in a bit of a blur, I don't think I was accepting. I know I was quite a few years into having been diagnosed at that point. but the rest of my life was really being prioritized as opposed to my own personal journey. One thing we also know is that a lot of people make changes to their diet. So you can see on the slide here, 94% or over 94% of people make changes to their diet. And what I mean by diet is not that they're on a diet, I mean that it's their eating pattern. And of those people who do make changes, we also know that about 1 in every 5 follow a specific diet. Now, the reason I've got diet in inverted commas there is because we don't really have a true diet for MS. There are lots of different options out there, and we'll talk about some of those in a moment, but we don't necessarily have one clear, you must follow this pattern of eating for MS, and that's what's going to work well for you. It may be that each individual has that's going to work for you, but as a whole, we don't yet have those recommendations. And that's a nice segue to my next slide, because we have those recommendations for exercise, which is one component of lifestyle management, but the nutrition space, we're not there yet. We still have a lot of consistency to find in the area of nutrition or in the area of healthy eating. We do know certain things are working relatively well, and that there are certain things that are better than other things that can be done from the nutrition space. But we don't have nice, clear guidelines like for exercise, where they say that you should be doing 2 to 3 days per week of aerobic activity, 2 to 3 days per week of resistance activity. It's nice, clear, and structured. And I've got the link down the bottom of the slide there in case you do want to read those guidelines. Eva, it probably requires a bit of quiet time to read through those. But we haven't yet got to that point where we can say the same thing for nutrition. We've got a long way to go and lots of studies still to run before we can say that. But that doesn't help those of us who've already been diagnosed and want to know what to do. And that's why we've got some of the tips and tricks along the way that I'll also mention as we're talking through. So we do know that there is a strong link of nutrition or of food on MS generally. There's a lot that food does influence in this space. And in particular, I mean, you can see on the slide, anxiety and depression. We know that there's a strong food association between anxiety and depression and MS, whether there are symptoms or whether there is isolated conditions. We know that we can change our cholesterol level. So if we have high cholesterol, we can actually change that and reduce it in the majority of cases by changing what we eat and how we exercise. Same thing with our body weight. We can make shifts there that are positive, and we can reduce the inflammation that's occurring in our body. That's having a flow-on effect to the relapses that we're having from the disease. Our level of fatigue, for example, which is one of the most common symptoms of MS, can be changed through differences in patterns of eating. Constipation, we're quite familiar with that one, where we need to increase our fibre and water intake, which will reduce constipation as a symptom. And of course, then as the disease becomes a bit more progressive, some people end up with difficulty swallowing as well. And that's another thing we need to think about, because difficulty swallowing is food related, and we need to be aware of the differences in food intakes that we need to be providing to those people or recommending to those people, as opposed to people who aren't having difficulty swallowing, or it might even be intermittent difficulties. So that provides you with a little bit of insight into the different areas that we could change that relate to MS, but we haven't got anything specifically for MS as a whole at this point. However, I'm just waiting for my screen to change. We do know that it goes well beyond. So it's not just about, you know, if I change this pattern of eating, then this will be the outcome. We know we need to think about a lot of the factors. So, you know, what are the literacy levels, or the food literacy levels in particular, of people, so of yourselves? You know, are you able to cook? Are you quite familiar with the kitchen and how to prepare food? Or are you very much, I don't like kitchens, I'm happy to stay out of the kitchen as much as I possibly can? You know, are you able to afford the food that you need to afford? Are you food secure? You know, do you have the right environment to be able to afford the foods that you need to be able to purchase? Do you have any religious or cultural beliefs that you need to layer into your patterns of eating as well? Not need to, or, you know, want to is usually the case. Is there a certain level of disability that you're faced with that makes it difficult for you to, you know, open containers, or even to interact with the utensils that you need to be able to eat your food? Are there particular taste preferences or taste aversions that you've come across as a result of your medications? Are there any issues with your teeth, you know, dexterity in your hands, your age? There are so many factors that go beyond just the food and the drinks that we need to think about when it comes to food and nutrition. It's not just as simple as you should eat this particular food item and that's the end of it, it'll make everything better. We've got lots of things to think about, but here's the main one that most people do think about when it comes to MS. Now, this one we haven't got set up as a poll, so I'd like you to actually use the question pane, and rather than asking a question, you can just type in your response for this particular option, because what it's going to tell me is a little bit about what you know around MS diets, or what you've tried around MS diets and your condition. So knowing that some of you are newly diagnosed through to people who could be taking my place and running this webinar right now, I'd be really keen to see what you've come across. And hopefully you can all use that question pane.
Yeah, they're coming in now. So we've got
Beautiful.
Someone saying I've modified the SWANK diet, intermittent fasting, Dr. Jelinek, the Mediterranean diet. We've got a no dairy, no red meat, no gluten, no alcohol, no processed food, and no sugar.
Yep.
So the OMS and the WALS, SWANK, CSIRO diet, intermittent fasting again, no MS diet, overcoming MS, a few of those have come in.
Yep.
Yeah, WALS, Mediterranean, intermittent fasting. So quite a lot of different ones, and we're not seeing many multiples of any of them. No meat, no cheese, no red meat or dairy, anti-inflammatory diet has come in.
Yeah.
Yeah, so definitely
Beautiful.
a few WALS diets coming in, and overcoming MS as well.
Okay. Well, thank you again for responding. I guess for me that gives a bit of insight into the diversity of the group that we have here online today, because the common ones, I guess the common MS diets have definitely popped out there. So the WALS diet and the OMS, or the overcoming MS, are definitely very popular. So the WALS diet being a modified Paleolithic approach, where lean meats and fruit and vegetables are prioritized over grains, generally speaking. So similar to your Paleolithic approach way back when, a few years back. Then we've got the overcoming MS, which prioritizes fruit and vegetables again, with some fish intake as well, but largely limits dairy and meat intake. The SWANK was, I guess, one of the original MS diets that was proposed, and it's a low-fat approach to eating, of which a lot of these other dietary patterns have sort of evolved, because there was a strong association from the research that was done around the SWANK diet in relation to the saturated fats, or the fats that we don't necessarily want to consume as much of, and interaction with the symptoms and the progression of MS. They're probably the main leaders in the MS diet space, but I'm hearing a lot of modifications coming through from the responses that you guys have given. So the reduction of refined sugars, the reduction of the complete removal of alcohol, cutting out cheeses, things like that. And this is again reflecting the fact that MS is a unique disease. It's not something where we'll necessarily have a one-size-fits-all. And it's the same thing with the slide I've just shown you before. Any pattern of eating is not going to have a one-size-fits-all, but there are definitely some approaches that will work for certain people, and there are definitely some approaches that will work less so for other people. So it's about tailoring it to your needs, to your environment, to your lifestyle, to your family situation, your living conditions, and your taste preferences, really importantly as well. You don't want to be eating something that you don't like. There's nothing worse that I can think of, that if you're required to eat something that really doesn't taste very good. Because for me, it's all about the eating experience and enjoying food and enjoying that pleasure of eating with other people as well, in the social environment. So that's a quick spiel there in relation to the MS diets. There are definitely a lot that I haven't even touched on today. I could probably do a whole another webinar just about the diets themselves, but we're looking at a few facts and fallacies today around the strongest areas of research related to multiple sclerosis and nutrition. So what the poll also, or the question rather, also showed me just then, is that we are really hit with an influx of information. So we have things coming our way left, right, and centre, books, information on websites, family telling us what we should be doing, all sorts of information being thrown at us from different areas. And it's a lot to take on board. It's a lot to take on board when you're newly diagnosed in particular, because you already have so much information coming your way. I know when I was diagnosed, I did not know what MS was. I had no idea. It definitely was a steep learning curve for me. And I definitely can say I have a bit more of an idea these days. But you can see just from the examples on the screen here, some of the diets we've just spoken about have popped up on the screen. And these are just a few of the books that are out there. So I'm not even touching on the websites that are out there, let alone the various infographics, the various social media posts, the various influencers. It just goes like crazy. But basically, it's showing that we have an influx of information and we need to filter through that information to work out what's the best fit for me, but also which information is actually credible. Because having someone write a paper or write a book that might have a doctorate or have the name, title of doctor in front of their name doesn't necessarily always mean that what they're saying is correct. So we are overloaded with information. We actually know that a lot of people have a big long search online, and I'm pretty sure I could call it a Google search at this point, to look for medical information before they even go and have their first appointment with their neurologist or with their healthcare team. So they've been newly diagnosed and they go out, and 82% of people are already collecting information about their disease. Not surprising, because if you're told you've got X, and in our instance, X is MS, why would you not go searching for more information? I know for me, all I knew at the time when I was diagnosed was there's this MS readathon. That was about the extent of what I knew at the time. Thankfully, the readathon is still out there and very successful, but I know I needed to know a lot more. And that's the same thing, obviously, for other people. So as part of the work we did at Wollongong is we've had a look at some of the websites that are out there as well, to have a look at the accuracy of those websites, to see if they needed to be modified in a certain way, to see whether people needed a certain level of health literacy and whether they're only of a particular quality. The scary thing was, though, that less than half of the websites actually contained accurate information. And that was a big eye-opener for us, because less than half is not ideal. The stronger quality or the higher quality was definitely seen in relation to the advice that was given by dietitians, thankfully, by doctors as in general practitioners, and by medical organisations. But that was generally speaking, and like I said before, not all the time was it that a doctor was providing accurate information on these websites. And it's a scary place to be, because in terms of that, we then also had nearly 40% of the websites actually recommending a special diet. You've just heard me saying that we don't actually have a particular dietary guideline or guideline message for people with MS yet. So why are special diets being recommended? The special diets are being recommended because it's a way of taking control of something, and taking control of your food intake is something that people can do to help self-manage their condition. And as long as it's not done for too long, or if it's done in an extreme way under the guidance of a health practitioner, I'd say probably a dietitian would be good there, then it's not as big a concern as if you jump on board and just make extreme changes without the support. One thing we did also find is those websites that had those special diet recommendations were generally the ones of the lowest quality. And that's a big flag, a big point to really iterate today, because be cautious of what you're reading, I guess is the point that I'm saying, particularly for those of you who are new to the process. Be aware of what you're reading, be careful, critique everything that you're reading coming across, and particularly what your family and friends tell you, because there can be some real doozies that come your way. But what's even more so, and I've got a bit of a lag happening at the moment, is it's not just the websites. So our social media platforms, and I've used YouTube as an example here just for this webinar today. We also did a similar thing where we looked then at the YouTube pages that come up when you type in MS and nutrition. And funnily enough, the most common diets, so to speak, that came up were the need to follow a vegan diet and the WALS diet. So the WALS I mentioned before was that modified Paleolithic approach, and the vegan diet being the complete elimination of all animal-related products. The OMS diet was also pretty common in terms of the video titles, but we've already heard about these approaches, and we know we need to be a little bit cautious. I'm not saying completely avoid them, I'm saying just use them with care. The other thing we also did find is that doctors, and this is not necessarily neurologists or general practitioners, doctors generally speaking, so that can be a doctorate, as in a PhD doctorate, it can be a doctor of dentistry, it can be a number of different doctors, but they were more likely to endorse MS diets. So we found almost 94% of the YouTube pages were endorsed by a doctor of some sort. And this was really encouraging an increased number of viewers. And it was also encouraging an increase in purchase requirements within the YouTube platform. And they were also seen as predictors for endorsing those MS diets. So the fact that the doctor was endorsing, the higher view rate, and then the perceived quality of the video was seen to be an endorsing factor. Again, I reiterate, not all doctors are trained in nutrition. Just keep that one in mind. I have a feeling my kids are not staying off the internet. I've got a bit of a lag going. I apologise for that. But of course, the reason for all of this is because anyone who eats food is an expert. We should all know that by now. So, I probably have a whole range of experts listening to me right now saying, nope, that's not right. A lot of people are taking on board food as a really important element of their lives, like I've mentioned before. But for other people, food is really not the highest priority for them. So, make sure you look at food in the context of how it sits for you and how it sits for your particular instance and your particular lifestyle. So, taken me a fair while to get here, but we're now up to the section about the facts and fallacies related to nutrition. I've already debunked a few things along the way there, but now I'm looking at a few particular areas where we have some strong or not so strong, we'll see, research out there in relation to nutrition and MS. So, as you might have expected, we have another poll. So hopefully Peter will have this poll open for you, and I think I can see it has been opened. This one's in relation to whether you need to cut out meat and dairy when you have MS. And this is a nice easy one. It's just whether it's a fact, whether it's a fallacy, or whether you've got no idea.
So a lot of people have voted now, and we've got about 2/3 fallacy,
Okay.
20% I don't know, and about 15% fact.
Beautiful. I like that we've got a bit of a split there. So I'll run through some of the science that I can tell you about in this space. My slide did a very quick change there. I wasn't expecting that quite so quickly. But we know a little bit about dairy, and dairy in particular, and MS inflammation, because MS in the body is a form of inflammation. Basically, it means that your body is responding to something that's happening in a way that's a little bit more rapid than if it wasn't. So if we didn't have MS, you may not have that same level of inflammation. And there are also factors that can occur in the body that increase the inflammation beyond the MS. So for example, if you carry a little bit of extra weight, you're actually increasing the inflammation of your body and your bodily systems in addition to the inflammation that the MS is already providing. But bringing it back to dairy, the idea here is that we would need to cut out particular foods that have an effect on inflammation. And there was a lot of controversy around the space as to whether yes, we do, or no, we don't. Dairy is such a big food group, so it covers anything from cheese and cream and ice cream right through to yogurts and skim milk, I suppose. So a lot of different food types encompassed in that group. So I went back to the research to see where we're standing with it at the moment. And what we've actually found is that if you compare healthy people, so those who haven't been diagnosed with a chronic condition, with people who have been diagnosed with a chronic condition, it was actually finding that there was no effect. There was no difference in effect of consuming dairy or not consuming dairy. So there wasn't any sort of difference in inflammation there. And the reason we compare healthy people with people then who have a chronic condition is so that we can see, is there an effect that's happening above and beyond for people who might have a chronic condition like MS? So what we actually found from this review paper that I'm referring to here is that most of the studies actually showed, and this was a review of lots and lots of studies in relation to inflammation in dairy, they actually showed that dairy was suggesting an anti-inflammatory effect. as opposed to an inflammatory effect, which is often the case, and that's often what's promoted on many MS websites, that we need to cut dairy out for the purposes of inflammation. There are various components of dairy that may be targeted, so whether it's the lactose in the dairy or whether it's the milk proteins, whether it's any other component, or whether it's even the fat composition. But generally speaking, we're starting to see that not necessarily as vital to cut dairy out as was previously perceived by certain groups. We've also had a look at dairy in relation to the risk of MS, and we've checked to see whether there's an effect there in a similar type of way. So is consuming dairy going to make a difference for people who are, I guess, healthy compared to those who've got early signs of demyelination, so early stages toward having MS? And again, we found no result for dairy consumption. So that was a nice finding in relation to the diversity of dairy, because it is such a large food group and it does provide some really important nutrients. So calcium in particular is one of the main sources, one of the main nutrients that you receive from consuming dairy. There are obviously other forms out there where you can receive your calcium from those other forms of food. But the main thing to keep in mind there is that as an overall food group, you don't need to cut every single form of dairy out, generally speaking. There even seemed to be a bit of a protective effect that was suggested in relation to yogurt. And that may be because of the probiotic effects that the yogurt could contain and the interaction between the gut and the brain we're hearing a lot about at the moment. The main thing to keep in mind, though, with the results here are that these probably would need to be repeated to see if the same finding would be happening in people who are diagnosed with MS or later in the disease process, because this is very, very early stage. Then in terms of meat. So meat, we had a bit of a look at in relation to generally stages of disability, fatigue and depression risk. And it was in quite a nice sample of Australians. And what we did there is we had to look to see whether there was a difference in the quality of food intake. So what we did actually find was that meat consumption at the start of the study was associated with a higher risk of increasing disability, but there were a number of factors that we need to acknowledge. So the facts, firstly, it was yes or no to meat consumption. So you either said, yes, I do consume meat, or I don't consume meat. And I think that's a very broad question to ask, because again, similar to dairy, there are lots of factors, lots of food types that can fit within a meat category. And there are lots of differing levels, I guess, of quality of meat within the food category as well. So you can have anything from your supermarket sausages right through to a nice lean cut or even a fish in the meat category, and it wasn't separated necessarily. So I think it's really important that people need to look at the types of meat that are being considered. And in this particular study, there was definitely a strong bias towards the OMS program of participation. So people were already following the OMS diet, which we spoke about just before, and OMS generally does encourage a strong reduction in meat intake and also in dairy intake. So a bit of a bias in the sample that was tested there. So we need to do a lot more work in a non-biased sample to work out some stronger associations in this space. But it's really showing that in this area that there's a strong feeling about in the MS community, which is one of the reasons why I've jumped straight on into meat and dairy. I guess they're the two most controversial areas when we're talking food and MS. But basically I'm saying be aware of what your requirements are. So some people eating meat might work for them and it might not have any effect in terms of symptoms or progression. For other people, they might prefer to limit meat. It's really a case-by-case basis. The main thing to be aware of is that certain forms of meat do provide also those important nutrients like iron, for example, from your red meats. And if we're talking about fish, you've got some of your omega-3 fatty acids there that are really important as well. So again, seek advice if you're looking for individualized nutrition information, but I'm generally providing some information overall as to what science is saying right now. So in relation to our poll, at this point, it's looking like it's a fallacy. So like I said, a lot of information, a lot of studies still to continue, but it's looking like we don't all need to cut out meat and dairy, but some people may need to remove certain food groups for various reasons. So if you have a lactose intolerance, for example, it probably would be a good idea to remove certain forms of certain food types that contain lactose. It doesn't mean that that everyone needs to remove lactose from their intake, and it doesn't necessarily mean that everyone needs to remove whole food groups, because it can make eating quite difficult when you're removing a lot from your pattern of eating. Okay, next one. We now have a question around, can eating well reduce vision and bowel symptoms for MS? Fact or fallacy? I can see the poll is open.
We have currently about 2/3 saying fact, about 1/3 I don't know, and it's sort of around 10% is fallacy. And
Okay.
yeah, most people have voted now.
Lovely, thank you. Okay, let's have a look into this one. And I'll jump straight on in with this one, because we're looking really into eating patterns here. We're looking into what can we do, generally speaking, to change or have an effect on our symptoms of MS. So we're moving away from the general disease progression, but more to the symptoms. And another nice large sample here, different study group this time around, but they were all people already diagnosed with MS. In this group, so you can see it's quite an active group in terms of making an effort to eat healthy. So we've got over 94% of people are making that effort to eat healthy. And again, a proportion of people, again, almost 1 in 5 do follow a diet, but not necessarily strictly follow a diet. So they might be following a modified version of the OMS, or they might be just cutting out certain things that they know has a bit of a flare up for them. The important finding really from this research was that a healthier pattern of eating, so eating better overall, which means basically consuming closer to the required amounts of the food groups that we are told to consume, was seeing positive effect on quality of life, which is always a good thing, less rates of depression, less pain, lower pain scores, so less pain as a symptom, and also a reduction in cognitive factors, in vision, and in bowel symptoms. So straight into our fact or fallacy there, because I think it's really important to push through the point that it's about balance. It's about consuming across the different food groups. And that's one of the reasons why I've got all those different foods shown at the bottom of the screen there. So you've got right through from your whole grains, your fruits and vegetables, through to your lean meats and your oily fish. That can be quite nicely balanced. And these are the ones that were coming quite through very strongly in relation to the efforts to eat healthily. I think the sample size that we're looking at in this particular instance was a nice way of showing that the finding is really holding true, that eating well can have positive effects to us in a lifestyle way. So eating well generally has a flow-on effect, then also encouraging more exercise, encouraging better sleep, encouraging stress reduction. So all of these factors that we know are good for us as people with MS. But one thing we definitely do need to keep in mind is that particular symptoms, it's not going to be a magic bullet where if we eat a certain way, suddenly our vision will improve or suddenly our cognitive symptoms will disappear. It's not as straightforward as that, but improving your pattern of eating overall should lead towards better change, or changes in the right direction rather. Now, one thing you do need to keep in mind though is the space of nutrition research in MS is still not very consistent. That's why we don't have guidelines yet. We had to look to see from all the different studies that are out there, so all of the papers that have reviewed the studies, that are whether they're focused on dietary patterns, whether they're focused on food, whether they're focused on supplements, or whether they're focused on any number of things related to nutrition, what was it telling us? And basically it was telling us that the information in relation to patterns of eating is very limited. So it makes it very difficult. The previous slide I'm saying patterns of eating that are healthier are the ones that are better for us in terms of symptom management, but then the studies aren't really showing us what are those patterns of eating yet. So there's a lot for us researchers to do in the space to work out what are those patterns of eating that can be beneficial for people. Now, the studies are really showing that the effort was put through into relapse, disability progression, identifying MRI lesions for disability, and also looking at fatigue. So they were the strongest areas of research at the time of this particular publication. And it was also looking to see where were the strongest effects. And you can see the dark grey bar for fatigue appears to have the strongest effect, but keep in mind we've only had 3 studies for fatigue. So overall, you're looking at the strongest effect in relation to relapse response and the studies. The other thing to keep in mind as well was a majority of these studies were focused on supplements. They weren't focused on foods, they weren't focused on patterns of eating. It was about the supplements and mainly supplementation of vitamin D and of omega-3 fatty acids, so fish oils and so forth. And for me, I guess as a dietitian, the idea that, we don't eat pills, we eat food. So where we can, I find it better to choose whole food sources where you can. Some instances people do need to supplement, but definitely seek the advice of your healthcare team in relation to supplementation. Don't just jump on board and take supplements for the sake of supplementing. Okay, so in relation to our quick poll that we had before, this one comes through as a fact. So yes, we can actually see differences and reductions in our vision and bowel symptoms for MS if we eat well. It's not to say that if we eat well, we'll immediately have a change and I'll suddenly be able to throw my glasses away. That's not going to happen. There are obviously underlying factors, genetics that come into play as well. But generally speaking, we see improvements in each of these symptoms when we do eat better by comparison to people who don't eat quite so well. And the other thing that I need to stress again, which you're probably quite sick of me saying by now, is that we're looking at a focus on patterns of eating. We're not looking at targeting single foods. We're not looking at bad foods versus good foods. We're looking at how can you eat overall in a way that is beneficial for you and your lifestyle. And in relation to you and your lifestyle, it's about making those quality food choices. So making sure that you choose foods that are rich in nutrients, that are easily accessible for you, that are available to you, and that taste good for you as well. One thing that's really nice to keep in mind is choosing a rainbow of different colours, because the rainbow of different colours generally means you've got a rainbow of different nutrients in front of you. So the rainbow approach to fruits and vegetables in particular is a nice one, and also encouraging the whole grain options and the reduced fat dairy options as well is currently encouraged as well. So the quality of the food choices over the quantity of the food choices is really vital. Okay, my last poll for you guys, and this one's around vitamin D. So can vitamin D only be obtained from supplements? Let's see what we've got coming through here. So it's a fact, fallacy, or I have no idea option again.
Yes, that's 95% fallacy and 5% fact.
Okay, beautiful. Let's keep talking through there. So you heard me saying it before, vitamin D is the most studied nutrient for MS. A majority of studies focus on supplementation, so that paper I referred to, we had 8 studies that found there was no effect, and 4 studies found an effect on MS progression and relapse, or progression or relapse. And then there were other studies that were looking at vitamin D status. Now, of those, there were 12 studies that observed an effect and 4 that didn't observe an effect. But what they're actually seeing is there's a difference between whether we're supplementing people and looking at whether people consume the supplements and have an effect, and between also having an effect on vitamin D status. So vitamin D status is the level of vitamin D that you have in your system and the level of vitamin D you can actually make use of. And that can be checked through a blood test. And you're probably quite familiar with these blood tests by now. If you've had MS for a while, we always get our vitamin D levels checked. But there was also some emerging work coming through to suggest that vitamin D might have a therapeutic effect. The important thing there is we don't know how much vitamin D we need for it to have a therapeutic effect. And even more important than that is stressing the fact that vitamin D can be toxic. So because it's a fat-soluble vitamin, it does get stored in the body. And because it gets stored in the body, we don't want to exceed the levels, because with our other vitamins, like our vitamin C, for example, it's water soluble. If we have enough in our body, we pass it out through the urine. It doesn't happen with our fat-soluble vitamins. So that's a really, really important factor to stress, that if we're going to supplement with vitamin D, be careful of how much you're taking. Don't assume that more is better. Really follow the instructions on the supplement, speak to your healthcare team, and be very cautious and diligent about how you do supplement if you choose to supplement. Vitamin D, however, does also come from other sources. So we can get vitamin D from food sources as well, and we can also receive our vitamin D from being out in the sun and having some UV exposure where the vitamin D actually gets converted in our skin. Now, some of the more common sources of vitamin D in our food supply are our oily fish. So you can see on the screen our canned salmon or tuna, or even our fresh salmon or tuna, sardines, anchovies, our barramundi, salmon, snapper. All those different fish types definitely have vitamin D in them. Our eggs also have vitamin D in them, and our red meat has vitamin D. Less so for our chicken and turkey. Definitely still some coming through. And something that a lot of people aren't quite aware of is mushrooms you can actually have vitamin D from, but there's a trick. It's not just any old mushrooms. So if you pop your mushrooms out in the sun actually converts or makes vitamin D within the mushrooms. It's something where you don't get as much vitamin D by comparison. You need to eat a fair few mushrooms, but we are getting vitamin D from mushrooms. Other countries also fortify their food products with vitamin D, so they add it to the product. So you might have heard of various countries having vitamin D in their milk or in their margarines or others. We don't have too much fortification happening in Australia, but we do have some coming through in terms of the margarines here in Australia at the moment. I guess the important thing there is I'm answering the question in relation to supplementation, and we can also get vitamin D from food. The most common way to receive vitamin D in Australia, because we do have quite a temperate climate, we do have a lot of, generally speaking, sun available to us throughout the year, is that UV exposure. But being careful of your sun-safe messages. So don't ignore sun-safe messages thinking that you're getting extra vitamin D by being in the sun for extra long. It doesn't work that way, unfortunately. There is a limit and there is a cap to the amount of vitamin D that your body can produce at the one time and at the one site on your body as well. So if we go back to our poll, and vitamin D can only be obtained from supplements, it sounds like a majority of people are onto this one already, but it definitely is a fallacy. So yes, we can obtain vitamin D from foods. We can obtain vitamin D also from being out in the sun, plus the supplements as well. Again, I'll stress the sunlight exposure is really something to be aware of here in Australia, and there are many different factors that affect sunlight exposure and vitamin D. And the food supply in Australia, we don't have too many available foods, but it's definitely a way to help boost your levels, particularly in those winter months when we have, I guess, less sunlight coming through in the majority of the country. So I know I'm getting close to 1:30, so what I'll do is I'm going to wrap things up a little bit for you. And I've got 5 key messages for you to think about. I guess the first one, unfortunately for a lot of people, we don't have a magic bullet food. There's no one food that we have to eat when we have MS to make everything better. Again, we need to think about the way that food patterns are unique to the person. We need to think about how the MS is unique to the person as well. And what we're seeing at the moment is that a balanced, healthy pattern of eating is really the best evidence that we have for reduction of symptoms and also for delay of disease progression. Also, be really aware and cautious of the nutrition information that you come across. So if something doesn't quite sound right, or if it doesn't quite add up, seek a second opinion, ask other people, try and speak with your doctor or your neurologist if they have time about it, speak with your MS nurse. A lot of the healthcare professionals that you deal with are becoming increasingly aware of nutrition, partly because we keep harping on about it as dietitians, but also we don't want people to be misinformed when it comes to food and nutrition in the MS space. Now, nutrition is just one component of looking after yourself with MS. It's not that magic bullet, like I said. It's not that one component of lifestyle that must be changed and everything else will change. You need to keep in mind the other factors of lifestyle that can also influence your MS. So make sure that you stay active, make sure you keep an eye on your stress levels, make sure that your medications are appropriate and up to speed. So speak to your healthcare team. You know, be conscious of all those different factors and also keep in mind the interactions of other components of your life. You know, are you a busy working parent, or are you retired and, you know, living by yourself? all these different factors are something that you need to think about when it comes to nutrition, but also to MS management. I also think keeping positive relationships with your healthcare team is really vital. So your healthcare team are there to support you. Most of the time, they're going to be there to support you in the long term. So choosing a healthcare team that you relate to, I think, is really important. I've shifted my team a few times, and once I received or came to a team that I'm happy with, I am very, very happy with them and have been in the long term now. But it took me a while to get there. And I think you need to feel comfortable being open and honest with your healthcare team, because that openness and the honesty is really what will help them to provide you with better advice as things change in the disease management space. They really are there to help. And of course, if it comes down to food and you don't know what to do and your neurologist has no idea and your MS nurse has no idea and you can't find a dietitian, I have given you the web link there for how to find a dietitian. We have quite a number of dietitians across the country, across the different states, so you can have a look and see whether you have one nearby. There aren't too many MS specialist dietitians. We're slowly growing in numbers, not slow, but we definitely are slowly increasing, and the awareness is being raised amongst our profession. And if you want to have a bit more of a read in terms of what to do, what to eat, you may have seen this before. Our Australian Guide to Healthy Eating, which is based on our Australian dietary guidelines, is really the go-to place. So it's recommending intakes from the 5 food groups, things that you're probably aware of already. We don't need to cut out large amounts of any of the food groups. We just need to make careful choices and ones that are appropriate to our patterns of eating. There are also some guidelines that we worked on with MS Research Australia back in 2020 that have some more information in relation to modifiable lifestyle factors. And the link to that guide is also available on this slide. Now, before I move to questions, I do want to say a big thank you to the team that we have at Wollongong. These are some of the various people that I've worked with over the few years and do continue to work with. Big thank you to each and every one of them. I think our MS journey into the research space wouldn't be the same if they hadn't been involved. And now I'll jump across if anyone has any questions.
We've certainly had a few questions come through. I might just ask a couple, and then if we can't get to all of them, maybe I can email you separately, Yasmine, and then respond to whoever's asked a question over email.
Sure.
Thank you. So we had, I know you touched on anti-inflammatory foods. So there was a question, do you recommend an anti-inflammatory diet?
I did see that one pop up. Sorry, I hadn't responded to that one yet. My screen had shifted behind my slides. So in terms of the anti-inflammatory diet, I guess it's recommending those food types that will either increase or decrease the inflammatory response within our body. And it's very closely related to the Mediterranean diet. Now, while I'm not saying that there's definitely an MS diet, I don't think there's any problem with an anti-inflammatory approach or a pattern of eating such as the Mediterranean approach. It's very well established. It's now become the basis to the American dietary guidelines, and it's quite well balanced as well. So it looks at fruits and vegetables, nuts and seeds, using olive oil to cook, limiting meat but still consuming some meat, and focusing on fish intake as well. There are lots of positive messages coming through, and I think if an anti-inflammatory diet is based on positive messaging and foods that largely taste good, I think that's a good thing. And I don't think extreme diets are the approach to go with. So while it's still terms of diet, I'd say look at the pattern of eating, see how that relates to your own personal circumstances.
And I'll just get to one more question. I like this question. What about sweet foods like chocolate and pastries and cakes?
My little, it's my favorite things. I'm a chocoholic at heart. Again, it's the same message that you hear from us dietitians all the time. Keep in mind, moderation is the key. So I like to think of it as go for quality over quantity. If you're going to have, for example, for me, I love my chocolate. So I think, okay, I love a dark chocolate quality. I'm going to have a small amount quantity. So that's a similar message that you can keep in mind in relation to other things. a lot of those cakes and pastries and so forth do generally contain less of the nutrients that we need to be consuming and more of the appealing taste profiles that we like to be consuming. So if you keep that in the back of your mind and don't overdo it, I think with a balanced intake and with your usual exercise patterns and stress management, it should be okay. Again, if you're finding issues, then maybe avoid for a while and talk to your healthcare team.
Great. I will now take the reins and just run through a few extra slides, but thank you so much, Yasmine. That was very insightful, and always love to finish on a question about sweets, because I think it would be unfair if we all couldn't enjoy a few sweets every now and then. So I'm sharing the wrong screen, sorry about that. That did happen when you lost me for a bit there. Okay, so that's the right screen, I think. Yeah, so I'll just run through our services just quickly. So you can see there that MS Plus offers a number of different services, and if you are in need of extra support or you need someone to talk to, please ring us at Plus Connect. We do have a lot of services in a lot of different areas, so please do reach out, because we do have the services there, and they are very beneficial. So yes, call us at Plus Connect. I'll get that number for you in a second. So we also do have a number of resources. We have a podcast series. We have an e-newsletter that goes out monthly. We have a webinar library. So today's webinar will be recorded and put on our webinar library, which is the resource hub on our website and also on YouTube. So do please check out that. And if you want to rehash this webinar, it will be up there in the next few days. And we do online events on Facebook Live as well. So please follow us on Facebook. And yeah, so here's a number for Plus Connect. It's 1-800-042-138, and that's the number. We'll between 8 and 6. Someone will always answer the phone, and yeah, and that's sort of the gateway to everything at MS Plus and all our services. You also can email at connect@msplus.org.au. Yeah, so please do reach out. So just a final thank you, and thank you, Yasmine, and yeah, what a great presentation. I love the facts and fallacies approach, and it's always nice to weed through all of the sort of misinformation and the not so sure about that information on the internet and what we hear. So it's always good to hear from the professionals. So yeah, thank you, and thank you to everyone for coming today.